right, work me through this one here.
Okay, which of the following is the most likely diagnosis? So skim the answer choices. We know we're dealing with some kind of neoplasm carcinoma. Okay. So 35-year-old female presents to the clinic with a painless, palpable mass in the anterior neck. She denies any changes in voice, difficulty swallowing, or recent infections. On examination, there's a 2-centimeter nodule in the right lobe of the thyroid gland. Fine needle aspiration biopsy of the nodule reveals cells with nuclear clearing and grooves arranged in papillary structures. Which of the following the most likely diagnosis? Okay, so, well, I feel like I see grooves, and I feel like grooves has been I don't want to say buzzword, but I feel like it's been so like a phrase or at least a characteristic of a carcinoma that I read about. I think it's not anaplastic. I want to say it's papillary, but I mean it does say papillary structures.
So that's
So
your gut answer choice, correct?
yes, that's my
Okay.
gut answer choice. But just to kind of confirm, um, painless. So I see painless, and my first thought is thinking tender or non-tender. That's a distinction, but that's not with your carcinomas. That's with your, your subacute and all of that. So I know I scratched that train of thought. So I'm going to go with that because the other carcinomas just have different characteristics, and I think that's the big thing here.
Yeah, let's go with this here. So you remember kind of that they always I mean the old buzzword is orphan anti-eyes. Do you remember that?
Mm-hmm.
Orphan anti-eyes, they're just cells with nuclear, right? Nuclear clearing, meaning they're kind of empty, so they look like eyes. Okay, so that's what that is. And then arranged in papillary structures, meaning finger-like, right? So that's papillary thyroid carcinoma. Okay, a couple of things that you can distinguish, right? Just right off the bat, on a clinical standpoint, do you know what the most common thyroid carcinoma is? I mean, this is a little bit clinical by any chance.
Is it the papillary or
Yeah, papillary is going to be your most common. Okay. And then follicular and then medullary. And then anaplastic is going to be the least, but that's just incidence wise. So if you knew that, you can, hedge your bets on a test taking standpoint, right? But let's talk about this, right? So, painless palpable mass in the anterior neck, no difficulties in voice, swallowing, or recent infection. Why is this important? This will help you get rid of one of your answer choices. Do you know which one is going to get you to be able to delete?
um is it thyroid adenoma or
No, it's actually, what is the worst thyroid cancer? Do you know?
the anaplastic?
Anaplastic. So the most rare one is usually the worst one. So anaplastic is pretty like super aggressive. I think their survival rate is 6 months to a year after diagnosis. So people die very fast. So if you have anaplastic thyroid carcinoma, do you think you're gonna have changes in voice? 100%. Do you think you're gonna have difficulty swallowing? 100%, because it's so aggressive that it invades everything. So
Yeah.
more than likely, not gonna be the case. So then you're kind of down to these, right? So anyway, just little small things to pick up on, that you can kind of think and kind of you're increasing your odds of getting it right. You know what I mean? So
Yeah, that's good.
all right.